Hi, I'm Susan. I'm a registered nurse and graduate from Germanna Community College nursing program. When I was a nursing student, I found a lot of these tips and techniques helpful in taking tests and preparing for the NCLEX exam, and I think you will too. First, we'll talk about some different strategies, and then we'll work through some real problems. Let's get started.
Hi there, you're watching Test Taking Tips for Nursing Students. As you've probably found, nursing exam questions are very different from exam questions you've encountered in other courses. That's why we've developed this workshop to hopefully help you improve your overall ability to answer nursing questions correctly. During this workshop, we're going to discuss what critical thinking is, and then some test-taking strategies that are specific to nursing. Finally, we'll finish up with some practice questions. Maintaining a positive attitude is really key to your success to nursing school. Not only will it improve your overall ability to work well as a nursing student, but it will make the nursing school experience more positive and fun. Critical thinking is a goal-oriented way of solving problems, and to do it, you need to apply knowledge that you already know. This is why it's so important to build a solid foundation of knowledge in the beginning of nursing school and during your anatomy and physiology classes. Critical thinking aims at making judgments based on facts rather than just guessing. There are 3 levels of critical thinking, and you progress through these levels as you progress through nursing school. The first is basic critical thinking, and it's guided by rules and procedures and seeks concrete actions. The second level is complex critical thinking. This is where you further explore options, but you're still basing them on principles and patterns you've already learned and understand. The highest level is expert critical thinking, and it's guided by the uniqueness or wholeness of each situation or individual. It takes a while to get to this time because you have to build up your knowledge of nursing material and your clinical experiences. To become an expert critical thinker, you need to start practicing now. Nurses are required to think critically when working in the field, and this is why you're expected to start practicing this skill now. You must think critically on every test question. In clinical, you would first carefully observe. On your test, you need to carefully analyze each question, then decide what's important. Next, you'll need to look for patterns in relationship and identify the problem. In the beginning of nursing school, you transfer knowledge you learned from the textbook and lecture to exam questions. As time goes by and you gain more experience, you'll begin to transfer this previously learned knowledge with experience from the clinical setting to the new material you're studying and being tested on. As you progress through nursing school, the number and difficulty of the exam questions will increase and the material will continue to build on itself. The best way to practice critical thinking is to take lots of NCLEX style questions. First, you will examine the stem. This is the question itself. Read the whole thing, start to finish. Next, reframe the question, or put it into your own words. Then you will critique the stem. Ask yourself, what are they asking me, or what do they hope to find out? Before evaluating, see if you can predict the answer, and then evaluate the answers. Once you've made a selection, reread the question to make sure it makes sense. Identify the key concept as you break down the question. Make sure you're thinking like a nurse. Ask yourself, what should I do? Assume this is the perfect nursing world and that you have plenty of time to complete the necessary actions. Avoid reading into the question. When we do this, we add information we assume is there but isn't really in the question. This can lead us to selecting the wrong answer, so make sure you're staying focused on what the question provides. Finally, eliminate any distractors. Once you've selected an answer choice, never change your answer. Your first instincts are right more often than not. One of the only circumstances that it would be a good idea to change your answer would be after rereading the question, you realize that you missed out on an important keyword like always or never. For example, you thought the question asked, what is an early sign of increased intracranial pressure? So you selected stupor and coma, but the question was really asking you, what is an early sign of increased intracranial pressure? So because you at first skipped over this key word, the correct answer instead is change of level of consciousness. If you come to a question that really confuses you and you're unsure of the answer, don't give up on it. Assume that you can always figure out the answer. Making an educated guess is better than making no guess at all or just a random guess. It's a good idea to start answering lots of practice questions your first semester of nursing school. Review all the questions and the rationales. Reviewing correct answers helps reiterate information you already know and builds confidence, and reviewing the incorrect answers helps you identify weak areas that you need to focus more on. You should all be familiar with Maslow's hierarchy of needs by now. Often you can use this table to help answer questions. If it's a priority question, then apply Maslow. For example, the patient's need to have the bed rails up is more important than their need to feel loved and accepted by their spouse. This is because the safety need trumps the love and belonging need, the same way that any physiological need trumps any other need higher up on the table, like safety, love and belonging, esteem, or self-actualization. Always remember the ABCs, airway, breathing, circulation, are the highest priority physiological need, and they trump any other need. Identifying these keywords will help you recognize priority questions. Priority questions ask you what is the best, most important, first, or initial response by the nurse. It's common that most or all of the answer choices will be correct. As discussed in the previous slide, Maslow can help you determine the most important need of the patient. Always look at each answer choice and ask yourself if it makes sense with regard to the disease or situation provided in the question. If it doesn't, eliminate that answer choice. As you read the stem of each question, identify the key words. Here are some key words to look out for. First, initially, best, priority, safest, most, not, except, never, contraindicated, avoid, and least. Here's a strategy using keywords in the answer itself to narrow your choices. Keep in mind that answer choices with absolutes are often incorrect. Here's an example. The question states, the nurse is giving a patient a bed bath. How can the nurse best improve the patient's circulation during the bath? Answer choice 2 says utilize only hot water. Because the word only is an absolute, we can be pretty confident that this choice is incorrect and eliminate it. Each answer choice we eliminate improves the probability we'll pick the correct answer. Here are some tips for answering true and false questions. Watch for absolute keywords. These are words like always, never, all, or none. Qualified statements including these words are probably false. If any part of a statement is false, then the entire statement is false. So go ahead and eliminate it. There are usually more true than false answers. Most true statements come right out of the textbook or lecture. And try to make yourself work quickly. Try not to overanalyze the answer choices. These are the 4 cognitive difficulty level of exam questions. You have to build proficiency at each level to increase your ability to correctly answer questions at a higher level. Each builds on the next. At the beginning of nursing school, there are a higher percentage of knowledge and comprehension-based questions. Each semester, more application and analysis questions are integrated into the curriculum and less knowledge-based questions. By the time you graduate, most exam questions are application analysis questions. Your critical thinking abilities will improve with practice, time, and experience, and so will your ability to correctly answer higher difficulty nursing questions. And this is how you prepare for the NCLEX. Knowledge questions require you to remember information. Here are some tips to help you with knowledge-based questions. You can use flashcards to help you memorize information, or alphabet cues like CAB to remember that compressions, airway, breathing are the instructions for CPR. Another example would be remembering the 3 P's of diabetes mellitus to remember the symptoms, which are polyuria, polydipsia, or polyphagia. You can also use acronyms to memorize information. An example is on the bottom right of the screen here. The word infect is written, and then after each letter are word or words that describe the symptoms of infection. Here's an example of a knowledge-based question. When you are administering medications, QID means once a day, twice a day, 3 times a day, or 4 times a day. To correctly answer this question, you have to know the meaning of the abbreviation QID. And of course, it's 4 times a day. Here's another knowledge-based question. A patient is receiving a low-sodium diet. What food should the nurse teach the patient to avoid because it's high in sodium? Stewed fruit, lunch meats, whole grain cereal, or green leafy vegetables? To correctly answer this question, you have to be knowledgeable about the nutritional content of various types of foods. And of course, the correct answer is lunch meats because it's high in sodium. Comprehension questions require you to not only memorize information, but to also understand that information. Here are 2 tips to help you with comprehension-based questions. When you're studying, ask yourself why or how the information is important. This makes the information more meaningful and can help you retain it for longer. Here's an example. You learn that immobility is a risk factor for pressure ulcers. The next step would be to ask yourself why that is. Then you would learn that the pressure compresses the capillary beds, interfering with oxygen and nutrient transport to the tissue. This causes ischemia and ultimately necrosis. Sharing your understanding of the nursing material through small group study helps to promote your comprehension of that material. Here is a comprehension question. After administering an IM injection, the nurse should massage the needle insertion site to limit infection, prevent bleeding, reduce discomfort, or to promote absorption. To answer this question, not only do you have to know that massage is one step of the procedure for an IM injection, but you must also understand the consequence of massaging the needle insertion site after the needle is withdrawn. The correct answer is promote absorption. For this question and the next, I'd like you to pay special attention to the terms. First, we need to read our stem. What is associated with a physiologic need of a patient with a colostomy? What is the key word? In this question, it's physiologic. Now let's reframe the question. What is it really asking us? Well, we have a patient with a colostomy and we need to identify a physiological need for a patient with a colostomy. Let's look at our answer choices. The first is disturbance in body image. Is this a physiologic need? No, it's a psychological need, so we can eliminate this answer choice. The next is inadequate nutrition. Is this a physiologic need? Well, yes, it is. But does our question indicate that our patient has inadequate nutrition? No, it does not. We can eliminate this answer choice. The next is lack of knowledge. This is not a physiologic need, so we can also eliminate this choice. Our last answer choice is skin breakdown, and this is a physiologic need associated with the patient with a colostomy. Let's look at the same question with a different term. First, we will read the stem. What is associated with a psychologic need of a patient with a colostomy? This is the same as the question before, except for that the word physiologic has now been replaced with the word psychologic. And this is our key word. Let's reframe the question. We need to find out what is a psychologic need of a patient with a colostomy. Next, we'll look at our answer choices. The first is disturbance in body image. We determined before that this is a psychologic need of a patient with a colostomy. So let's hang on to this answer choice. The next answer choice is inadequate nutrition. This is not a psychologic need. It's a physiologic need. So we can eliminate this answer choice. The next answer choice is lack of knowledge. This is a psychologic need. However, our question does not indicate that our patient has a lack of knowledge. You can eliminate this answer. The last is skin breakdown. We determined in the question before that this is a physiologic need and not a psychologic need. So we can also eliminate this answer choice. This leaves us with our first, disturbance in body image, which is a psychologic need of a patient with a colostomy. First, we'll examine the stem. The nurse in a long-term care facility is caring for a group of older adults. The nurse identifies that older adults tend to have higher blood pressures because they have. Before we read the answer choices, we'll reframe the question. Older adults tend to have higher blood pressures because of, and then we fill in the blank. Now we'll critique each answer choice. The first is aging hearts. They do have aging hearts, but this doesn't give an explanation of why the blood pressure is higher, so we can eliminate it. Our second choice is thicker blood. This is a false statement completely, so we can just throw it out. The third is lifestyle stressors. Stress does affect blood pressure, but this explanation does not affect specifically older adults. It affects all age groups and doesn't necessarily worsen with age. This is when we need to remember not to add to or read into the question. The fourth option is less elastic vessels, and this is the correct answer. Older adults tend to have higher blood pressures because they have less elastic vessels. Remember, we discussed tips to answering comprehension questions, and that it's important to learn how and why something is what it is. Here's the rationale to this question. As people age, there are vascular changes and the accumulation of sclerotic plaque along the walls of the vessels occur, making them more rigid. Vascular rigidity increases resistance, which ultimately increases the blood pressure. Application questions require you to use or manipulate information in a presented scenario. Here are 2 application question tips. Relate new information to prior experiences. Applying nursing principles and theories in concrete situations reinforces your ability to use them in future circumstances. For example, when you're studying surgical asepsis, recall an experience performing a sterile technique and identify the principles that were the foundation of your action, like only touching sterile gloves to sterile supplies, and if you dirtied the sterile field in any way, you had to start over. The concept of sterile technique is the same during all sterile procedures, whether it be sterile gloving, an IV start, or Foley catheter insertion. The second tip is recognizing commonalities. A commonality exists when 2 different situations require the application of a similar principle. When studying gravity in grade school, you learned that it's a force pulling all mass towards Earth's core. Apply this understanding of gravity to the nursing world. We hang a liter bag of normal saline higher than the insertion site to run fluid without a pump. Or in peritoneal dialysis, we hang the diacylate bag above the abdomen during administration and later drain the diacylate waste by placing the bag below the abdomen. Another example where we use gravity to our advantage would be raising the foot of a bed for a patient with pedal edema or placing a pregnant mother in the Trendelenburg position to take pressure off the cervix. Let's look at an application question. When lifting a heavy patient higher in bed, the nurse can prevent self-injury by keeping the knees and ankles straight, straightening the knees and bending at the waist, placing the feet together and keeping the knees bent, or positioning the feet apart with one foot placed forward. For this particular question, you have to understand the principles of body mechanics and then apply these principles to this particular situation, which is moving a heavy patient higher in bed while preventing self-injury. The correct answer is 4, positioning the feet apart with one foot placed forward. Here's another application-based question. The nurse is assessing a patient who has a rash on his chest and upper arms. Which questions should the nurse ask in order to gain further information about the patient's rash? Select all that apply. When you're answering this select all that apply or any select all that apply question, you'd want to analyze each answer choice in a matter-of-fact manner and as if it's a true-false statement. Let's first reframe the question. What can the nurse ask the patient to help them obtain further insight to the rash? Let's read our answer choices. When did the rash start? Are you allergic to any medications or foods? How old are you? What have you been using to treat the rash? Have you recently traveled outside the country? And do you smoke or drink alcohol? All of these answer choices are appropriate if you are obtaining a full health history. However, our question is specifically asking us to gain information about the rash. Now that we've read all of our answer choices, let's look at each one and narrow it down. When did the rash start? Yes, that's certainly an important question to ask in regards to the rash. So we'll select this choice. Are you allergic to any medications or foods? This is a good question to ask them as well. It would help us determine if the rash is an allergic response to something. So we would select this answer choice. How old are you? Well, this answer choice would be good as part of the health history, but it's not going to help us learn any more about the rash. So we can eliminate this answer choice. What have you been using to treat the rash? To learn more about the rash, we would want to know what they've been using and if it made it better or worse. So this would be an appropriate question to ask the patient. Have you recently traveled outside the country? This would also be a good question to ask them because they could have had a foreign exposure to something that started the rash. And do you smoke or drink alcohol? Like answer choice 3, this would be an important part of a health history, but it doesn't help us specifically learn more about the patient's rash, so we could eliminate this answer choice. Let's look at this application question. A patient has just returned from the operating room with a urinary catheter, an IV, an oral airway, and is still unresponsive. Which nursing assessment should be made first? Let's reframe the question. We have a patient that's just returned from the operating room, they're unresponsive, and we need to decide which is the first nursing assessment to be made. The word first is our key word in this question, and it also lets us know that we can use Maslow's hierarchy of needs to help us decide an answer choice. Now let's look at our answer choices. Check the dressing to ensure it is intact, confirm the placement of the oral airway, examine the IV site for infiltration, and observe the Foley for drainage. Of these answer choices, they're all assessments that need to be made by the nurse. We need to decide what is the first thing she should check. Using Maslow's hierarchy of needs, we know that physiological needs are the most important needs, and of those needs, the ABCs, or airway, breathing, circulation, take precedence over anything else. Using this process helps us know that answer choice 2, confirm the placement of the oral airway, is the first assessment that should be made, and the correct answer. Analysis questions require you to interpret a variety of data and recognize the commonalities, differences, and interrelationships among the presented information. I strongly recommend you take lots of practice tests to get better at analysis questions. Be sure to utilize all the resources available to you, whether it be ATI, PrepU, or the supplemental resources that come with your textbooks, like the Point Online or the NCLEX 3500 that's available on the CD-ROM in your Med-Surg book. You can also purchase NCLEX practice books or download apps to a smart device so you can practice questions anytime on the go. Let's look at this analysis question. A patient who is undergoing chemotherapy says to the nurse, "This is no way to live." Which response uses reflective technique? Tell me more about what you are thinking. You sound discouraged today. Life is not worth living. Or what are you saying? To answer, you must understand the communication technique of reflection and that it's a therapeutic communication technique involving the process of listening to what the patient says, interpreting that information, and then reconstructing the main idea of what they stated and offering it back to them. It's also helpful to understand the therapeutic communication techniques of clarification and paraphrasing to eliminate other answer choices. You must analyze each statement and identify the use of these techniques. This question requires you to understand, interpret, and differentiate information. By using this process, you conclude that the correct answer is "you sound discouraged today." Let's first examine the stem. A patient is brought to the emergency room complaining of pressure in her chest. Her blood pressure is 150/90, pulse 88, respirations 20. The nurse administers nitroglycerin sublingually as ordered. After 5 minutes, her blood pressure is 100/60, pulse 96, respirations 20. Which of the following should the nurse do next? Now we need to reframe the question. What should the nurse do next after analyzing a change in vital signs? Our key word is next. To answer this question, you need to know vital sign parameters for an adult. It would also be helpful to know what nitroglycerin is, its purpose, nursing implications, and also any side effects. Now we need to read and analyze each answer choice. The first says notify the physician that the patient is hypotensive and obtain an order to administer IV fluids. We wouldn't do this because the patient isn't hypotensive. 100/60 is within normal limits, so we can eliminate this answer choice. The second is place the patient in semi-Fowler's position and administer oxygen at 4 liters. Again, the second set of vital signs that were taken are normal, so changing the patient's position and administering oxygen is unnecessary. We can eliminate this answer choice. Administer a second dose of nitroglycerin. Nitroglycerin is a vasodilator and it has anti-anginal, anti-ischemic, and antihypertensive qualities. Administering another dose would be unsafe and could cause the patient to become hypotensive. So we wouldn't want to do this, so we can eliminate this answer choice. The last is document the results and continue to monitor the patient. In this case, the vitals were within normal limits, so the results do need to be documented and the patient should continue to be monitored. This is the correct answer. Using these strategies will get easier with practice and time. We hope that you found this presentation helpful. If you feel like you need more individualized help, please come see one of our nursing instructional assistants at Tutoring Services. Thank you.